more than a health crisis. That's how President Obama described the Ebola outbreak in a speech at the United Nations this morning.
Ebola is a horrific disease. It's wiping out entire families. This is a growing threat to regional and global security. In Liberia, in Guinea, in Sierra Leone, public health systems have collapsed. With our help, they can put out the blaze.
We also heard today from Dr. Richard Sakra, who was released from a hospital in Nebraska where he's been undergoing treatment for the deadly virus.
The State Department and the CDC and our mission cooperated so well together. I was booked on a flight on Thursday. And the day I started feeling ill was really Tuesday. I was up in our ELWA treatment unit for 3 days. And then they had a plane headed here on day 6 of my illness. I would say, honestly, I never felt like I was horribly, deathly ill. Everything was handled so quickly. I was here on day 6. I was receiving medications. I was receiving plasma from my friend Dr. Brantley. And I think I really, I was quite ill for my first 3 or 4 days here. I was quite sick. And I know Dr. Sullivan could tell you more about how they wrestled with my my numbers to try and get things lined up straight instead of all upside down. But I never felt like I was not going to make it.
Dr. Sakra is clearly one of the lucky ones because, like the other 3 Americans infected, he received world-class care back here in the United States. Unfortunately, the same cannot be said for the more than 6,200 other cases in West Africa. Nearly half of those have been fatal to date. And today, the CDC is warning that the number of people infected could hit 1.5 million by early next year. That's a truly scary number. Dr. Frank Esper is an infectious disease specialist with University Hospital's Case Medical Center. He's here to help put this in perspective for us. Dr. Esper, that is a truly frightening number, 1.5 million potentially by early next year. Does that sound right to you in your experience? And if so, what are we going to do about this?
Yeah, it does sound about right. Just looking at the trend of the disease, it's the number of cases is doubling about once every 20 to 30 days. And so it's not, and those are only the cases that we recognize. There's a lot of people who are not as ill but still carry the germ, and they go under-recognized, and they can still transmit this disease to other people who will then get much more sick. And so about 1.5 million can go if this continues.
Wow, and there's another report. New England Journal of Medicine saying that we may not eradicate Ebola from these countries at all, that there's a possibility Ebola could become endemic among the populations there. Talk to us about what that means and what the implications are if Ebola were to become endemic there.
Well, the answer is it's always been endemic. It depends on what you're defining as being endemic. It came from somewhere. It didn't just spontaneously spring out of the ground. There's always been this virus within these countries, but generally within the animal population. And so there is still this animal that's carrying around Ebola. The animal itself doesn't get sick. This is a normal a virus for this animal, and the animal doesn't get Ebola disease like we get Ebola disease. So they're carrying around this germ and then can pass this germ from animal to human with closer contact with animals, or sometimes when those animals themselves are eaten. We're still not even sure which animal is the one that's responsible for transmitting this germ to humans. And that's one of the big things that we're looking at right now. Our best guess as it stands is right now it's a particular type of fruit bat that they've been able to isolate this virus from their bodies.
Wow. Doctor, some doctors are saying that Ebola survivors are showing a level of immunity to the virus, and thus maybe we should be using them to work with people who are getting infected and work through some of the issues there. Are you finding that immunity happening? Are you reading about that? And is that something that we can use to help out with this problem?
Well, our immune system is set to combat a disease, and then the second step is to prevent that disease from ever coming back. And that's one thing that we do with normal viruses that we see and normal bacteria that we see. So it makes sense that if you're able to survive the initial onslaught of this virus and the disease that it causes, that you would then be protected. But how long that protection lasts, how long that immunity will carry, that part we still don't know. It sense why some of the vaccine trials, all right? What are we doing with the vaccine? We're trying to stimulate your immune system to prevent the disease by giving you antibodies. In some of the people who have been treated here with the ZMapp, that particular medication is actually antibodies against the germ. So it makes sense that the people who survive this disease will carry some immunity, but we don't necessarily know if that immunity is going to be lifelong.
Right. Well, time will tell for sure. Dr. Frank Esper, thank you so much. Up next, cycling back to the big news of the afternoon, Attorney General Eric Holder's resignation. The official announcement less than an hour away, and we'll go live to the White House for the politics behind that decision next.